I'm gonna start with this amazing quote that Lisa found. So, una promotora es el rostro de la esperanza y una fuente inagotable de sabiduría comunitaria.
Hi, Dr. Laura.
Oh,
Sorry
hi.
to interrupt.
We can't see your
cannot-
screen.
It's so funny. Okay.
And
Thank
that quote
you.
is actually from Fabiola.
This is from Fabiola. Oh, that's so true. I love that. Thank you, Fabiola. This is a great quote. A community health worker is the face of hope and an endless source of community wisdom. That's amazing. Gracias, Fabiola, and thank you for that quote. Are you on today? Is Fabiola here? I should have Fabiola read it.
Up to Albuquerque for the conference
Oh, great.
this week.
Okay, thanks. Thanks for letting me know. Great. Okay, so let's go over COVID data. Actually, I'd just love a show of hands to see like how many people have recently experienced a person in their family or friends that got COVID recently. Because weirdly, we are noticing that, I don't know, I have family member that got COVID. My husband got COVID recently and he had not ever gotten COVID yet. So I do think that what we're seeing is that as people go inside more, you know, Omicron, just remember, it is still super, super contagious. We're now seeing, I know 2 weeks ago, this was all green, meaning that we had low community transmission everywhere. Now we're seeing some little patches of yellow. And even though the COVID community rate has been relatively low, we are seeing increases in COVID cases. So, you know, continue to use your COVID safe practices and encourage people to use the COVID safe practices when you are in super crowded places right now, just because there is more transmission and this is very contagious. You know, please be encouraged to wear a mask. I know we love not wearing a mask, but if you see this community transmission, you can see certain areas of the state are actually in red, where we're seeing a lot more community transmission. I don't know, I'm sure Miranda goes over it every week, but the green, this one, which is the community levels, takes into account hospitalization. And then this other one is just taking into account the cases and how much we're transmitting it. So you're seeing a lot in the Northwest. And then weirdly, this is a true thing. Somehow in the South and the Southeast, the Southwest and the Southeast, there is a lower transmission rate. And our epi team at DOH is looking into that, why they think this is the case, but it is a real thing, because initially we thought, well, is it like artifact because, you know, people may not be getting tested as much. A lot of our testing is still at home and not through PCR. So you just have to multiply every, you know, number that you see by 3 or 4 or even 5. Because a lot of people are being testing positive, but they're not, you know, necessarily sharing that through data, because we only use PCR lab test data, you know, the one that you go to like CVS or the hospital or your clinic to get, where they stick it in your nose like far back, and that's the PCR. The rapid test that we do at home, that doesn't get recorded. I have another announcement here as well. Does anybody here use NMDOH-CHWI to share your positive test results? You can raise your hands if you do. Does anyone have the app on their phone? NMDOH-CHWI app? Oh, great, cool. Sean, I see Sean raising his hand. I see Liesel. Okay, great. I don't know if anyone else uses that. That might be a really good tool as we go into the, oh, I see Zoom user have their hand up. I don't know who that is, but great. That's great that you're using that. So, you know, because we now have moved towards using more rapid tests, it's a great idea to go ahead and sign up for nmnotify.org. Lisa can probably put it in the chat. If you sign that up on your phone and then use that over the winter, that automatically tells you if you've been exposed to COVID, and you don't even have to know the person. It's anonymous data that just uses data between phones to say, you've been in contact with this person, you know, and you've been in contact with them long enough to potentially be a contact exposure. So, and it'll tell you what to do, like, please test, you know, and in a few days and things like that. So anyways, I just wanted to let people know that, you know, at the Department of Health, the data we use every week is the data from the PCR test, which is once again a subset of all the information that gets shared. And then when you do rapid tests, there used to be a piece of the data where we would actually have a portal where people could go into the portal on the DOH website to enter their rapid test data. But we no longer have that functionality on our website anymore, just because that data is not the data we use to make decisions. We use the PCR data, just because, you know, we don't know how many people actually use the portal. So just so you know, I don't know if anyone here was using the portal to report rapid tests, but we have gotten some calls to our call center where people are like, where's that portal? And we no longer have the portal. So anyways, any questions about that? Or maybe no one was using that portal anyways. Okay. Here you can see, like, as you see, here's a little uptick, and that's a little uptick we're seeing in COVID. So like I said, as we get into the winter months and, you know, gets colder, definitely, you know, be sure to stay safe from COVID. Once again, this is the Omicron variant slide. As you can see here, the majority of the variant is BA.5 and BA.4.6, and we're seeing other variants here, but really we're living in an Omicron world, right? So we are seeing all Omicron. So that's why this new booster, I know that you've had many talks on the Omicron booster, but this, like I said, this booster specifically covers Omicron. So as we're going into our Omicron world or continuing to be inside our Omicron world, this is a great time to get your booster and your flu shot at the same time, just because we're seeing so much Omicron. And like I said, Omicron is much, much more contagious than the original COVID. And this booster shot will cover the original COVID and the Omicron. Great. So next slide is on our COVID vaccines. And so this is great for everybody who decided they would want to do Novavax. And as you remember, Novavax is like the one that uses more traditional vaccine technology. So for people who are worried like, oh, I don't want to use mRNA, I don't know what mRNA is, this is good for people who are like used to like the flu vaccine and getting it every year. Well, now you can get the Novavax booster instead of the Omicron booster if they don't want the mRNA vaccine. And people can get the Novavax booster 6 months after finishing their primary series. So that's good to know, good news for the Novavax users. The Omicron vaccine booster for children, very exciting for people with kids who are younger than 12. Now it's approved for children 5 and older. They can get an Omicron booster. Your kids can get one if it's been 2 months since finishing their primary series or 2 months since their first booster dose. And I don't know, like, you know, any of you who are parents or you have little kids or not, but like that's the last thing you want is your kid to get sick. And, you know, and I know you've had that in a lot of your talks here as well, but kids also can get really sick from COVID and also can get long COVID. So anything we can do to protect our kids, I always think is great. Once again, this is the vaccination series for the primary series, or there's a bunch of other people who got the primary series plus 1 booster, primary series plus 2 boosters. We want to just encourage everybody and let everyone know, like, the Omicron booster is basically what we need now. Doesn't matter how many boosters you had in the past, doesn't matter what you got before, make sure you can just get that new Omicron booster. Because like I said, we saw in that Delta, on that variant slide, we are living in an Omicron world. So we really want to get boosted against Omicron. Great. And I don't know in the chat if anybody can say anything, but are people getting, being able to get their vaccines? Because we've noticed that there's some people are having trouble getting it in the north, primarily in the northeast, in the Taos area and Santa Fe. I don't know if anyone has had problems getting their booster, but let us know, because our teams are still available to do mobile teams. We still have mobile teams available. And if you have special events, we can still do those. If you want to get a bunch of people together to just all get their booster shots and not have to, figure out how to schedule a vaccine, we still have that functionality. So yeah, so if you want to get, especially you guys who have, working in the community, you can connect to all the people who really, need it this winter. Yeah, please reach out to us to get a mobile team going. Okay, any questions? Sorry, was someone asking a question? Okay, great. Also, mixing and matching COVID vaccines. Mixing and matching is also approved for people 5 and older. So let's say you went to, this has happened to a lot of people. They're like, I went to like CVS and they only have Pfizer, but I got Moderna. No problem. Go ahead and get the Pfizer or the Moderna booster. Doesn't matter, because you can mix and match. So that's a good thing. Getting a booster after having COVID. We've gotten a lot of those questions, right? If you just had COVID and would like to get a booster shot, you can actually wait 3 to even 6 months after your symptoms started. And I know for you guys as community health workers, it has been hard. It has been hard for us as regular providers, like everybody has been having trouble, because before it was just like, it wasn't all these different numbers of boosters and all the things that makes it seem more complicated. But what you can do is just be like, hey, let's not make it complicated. If you had COVID, you can wait. But if you think someone will forget in 3 months, you can still go ahead and get your booster shot, as long as you're 10 days out from COVID. So just kind of letting people know that, just if you want to have a simple message, but you can wait 3 months from after your symptoms. And let's see what's next. Okay, monkeypox update. So for the monkeypox update, we are definitely seeing a huge slowdown in the monkeypox. They've actually said that part of it also has been from people changing their risk behaviors. So monkeypox, it's, as you know, is spread through the lesions in the skin and skin-to-skin contact. And there have been over 28,000 cases reported in the United States, but only 51 in New Mexico. So I think people have done a really good job of changing their behaviors for monkeypox. And primarily, it's not necessarily called a sexually transmitted disease, but most of the people have gotten it from sex. And so because of the prolonged contact, skin-to-skin contact, so they've said that a lot of people have changed their behavior because of the messaging around that. So I think, once again, people getting vaccinated for monkeypox who are in high-risk groups. Basically, if you are a man who has sex with other men, or if you have multiple partners, sexual partners, then you're at risk. So that's really important to share with people, because a lot of people are saying like, oh yeah, I don't want to touch doorknobs, I need to wash my groceries. That's not how it's transmitted. It's really close skin-to-skin contact, and the people who are at risk should be encouraged to get the vaccine. And this is the information that we have that we're sharing about. Most of the cases have been in Bernalillo County, some in Santa Fe, and then all the other counties combined is 19%. So really it is mostly limited to the bigger cities. And then you see the age groups, it's really between the ages of 20 and 50 or 60 that we're seeing the most cases. And then mostly all in males. So this is really important, I think, for people to know, so that they know their risk, but they also know who's not at risk right now. Okay. Anyone else have any questions? Okay. And then the next one is about flu vaccine. This is really, really important, and thank you, Lisa, for highlighting this. Inequities in flu vaccine. The flu vaccine, just like the COVID vaccine, has inequitable rates, right? Right now, only 1 in 2, and flu can make you very sick too. Obviously, not as many people die or get very, very sick like is in COVID, but you still can die from flu. You still can get very sick from flu, just like COVID. But less than 43% of Black, Hispanic, and American Indian adults were vaccinated during the 2021 and 2022 flu season. And then by race and ethnicity, you can see who is getting vaccinated. So white at 54%, Black at 42%, American Indian at 41%, and Hispanic at 38%. And this is really important to know because that's kind of how the COVID vaccine has fallen out as well. You know, except that there's a lot more American Indian populations who've gotten vaccinated for COVID. But in general, the Black population, Hispanic population has lower for COVID. So I think it's really important for us to be like, how can we build trust more? How can we get people vaccinated so they don't get sick? Hospitalizations compared to white adults then, nearly 80% higher among Black adults for flu hospitalization. And then 30% higher among American Indian populations, and then also 20% higher among Hispanic adults. So really important to get vaccinated against flu, because that way we won't get hospitalized or as sick from the flu. And then flu hospital, oops, sorry, yikes. Sorry, I have to go backwards. Okay, so flu hospitalizations by race and ethnicity, same thing. You know, you see that the hospitalization rate is higher amongst Black populations. You can see here American Indian populations and Hispanic, then white is lowest. And of course, that's because of the vaccine, right? The more we're vaccinated, the less likely we're gonna get sick from flu or get really sick. So same thing as you guys have done during COVID is encourage people to actually get the vaccine for flu and COVID at the same time. Unfortunately, some of our sites only offer COVID and not flu at the same time. So sometimes you have to reschedule that, you know. But for like most of the pharmacies, they'll offer both of them. The things that you can do are the things that you guys have been doing, promoting community-based vaccination, partnering with trusted messengers, so such as you, all of you, using culturally responsive messages, and then, you know, emphasizing the importance of it. And so people look to all of you. So that's why we love sharing these messages so that you can get the message out as well. And then we also wanted to share mental health and grief resources. So here they are. We still have the 988 mental health crisis number that's available with 24-hour support, 7 days a week. They connect you with a behavioral health specialist. I know a lot of you guys in the CHW team have been working on this. So thank you so much for reaching out and being available for this option. There are 3 options when you call. There's a veterans crisis line, a Spanish line, and also a local crisis center line. And then I don't know if anybody who is one of the 988 CHW's team wants to comment more on that. I don't know if, I know CHWI team has been working on that. Do any of you want to say anything about this line or anything about that? Okay.
Hi, this is Sean Stambaugh here. I am the training specialist with the team. Just want to offer that we had our info session, our first info session about the launch of our behavioral health initiative today, this morning. And we will be having another information session for organizations that might be interested for applying for some funding for our behavioral health initiative, which includes 988. We will have that session, follow-up session on November 3rd from 1:30 to 2:30 p.m. And I think that's all I have to offer about that for right now. I don't know if anyone else from the team would like to add anything, but I did want to put that out there.
Thank you, Sean.
Yes, thank you, Sean. And I will also put the link to register for the session, for the upcoming session on November 3rd. So if you'd like to get more information on this, please register for that. Thank
Excellent.
you.
Thank you so much. Thanks so much for doing that. And we're really excited that, you guys are getting the word out because, we can do, I think that the reason why CHWs are so important is that we can do programs, we can do, and, different things, but unless we get it to the community and communities are able to access these things, then, we're not doing the best we can. So thanks for helping us do better. Okay, so let's see, sorry about that. Here's some mental health resources as well for Eastern New Mexico. Thank you, Lisa, as always, for putting together these slides and getting this information together based on everyone's questions. Mental health resources serves Curry County, Debaca County, Roosevelt, and Quay and Harding County. And they serve children and adults. They have an outpatient clinics as well that does group therapy as well. So this is another resource for y'all to use.
Es que se supone que vienes a una clase. Entonces, ¿cómo vienes a una clase y no estás?
Okay, great. All right, so the next slide is the Grief Center. So the Grief Center provides support groups, workshops, and resources for all who grieve, children, teens, and adults. There's no charge for their grief support services, which is great. And they're located in Albuquerque. And I don't know, Lisa, is that just for people in Albuquerque, or can anybody access these resources?
That's a good question. I was under the impression that it was just in Albuquerque, but we can look into that.
Oh, okay, great, thank you. Here's another one, the Dougie Center. Resources for all age groups, as well as other specific resources for various types of grief. And you can also find grief centers with their search tools. So that's really great. And then here's the community toolkit for grief. The Doug Center has community toolkits for friends and family, school personnel, counselors, for community members supporting others, and also offering COVID-19 specific grieving resources. And that's just so important right now. Like, so many people have lost family members or friends. And yeah, thanks so much for putting this together again. And then, yeah, that was the final slide. And here's the Happy Halloween slide. I don't know what people are dressing up for Halloween. I think I'm going to be a bumblebee because that was my costume from last year, and I cannot find another costume. I don't have time. So
Laura, we have some questions in the chat.
oh, okay, great.
So the first one is the Novavax booster also an Omicron booster?
Oh, the Novavax booster is not this specifically made for Omicron, but it is still a booster. So I think it's still important to get it if you are worried, like a booster is better, like having a booster is better than not having a booster. So I would still say go ahead and get that Novavax booster because it's still going to boost your immunity. The thing with getting boosted, it's two things, right? It's not just having the Omicron booster that's specific for Omicron, that's helpful. But the other thing is that over time, your immunity starts going down, just like a flu vaccine. So that's why every year you have to get a new flu vaccine, is because your ability to fight the infection goes down over time. And so that's why it's a boost, right? It gives you another boost for the immunity. So yeah, so I would say still get the Novavax vaccine if you're worried about, like, you don't want to get the mRNA vaccine. It's still really important because your immunity wanes. Yeah, it goes down over time.
Another question is asking for a number to call for the mobile vaccine teams.
Oh,
Is there a number, Laura, or is it just the request form? I wasn't.
it's that request form again, yes.
Okay,
Yes.
so there
Okay.
is no number that I know of, but I will put the link to the request form in the chat.
Oh, that's great. And you know what you can do? I mean, if you can't figure out the request form, like, feel free to call our call center. We are actually getting a high volume, but they can actually also direct you to the correct you know, when in doubt, call the COVID call center. They're probably gonna hate me for that, but that's what we're there for.
Another announcement that La Familia Medical Center has boosters in Santa Fe. If you're
Oh,
looking for Omicron boosters in Santa Fe, you don't need to call, or you do need to call and schedule an appointment. Sorry, and the number's in the chat.
okay, great.
Another question is about the iHealth at-home testing kits. Can people still use them after the December expiration date?
Yes, they're saying to us that you can use it 6 months after the expiration date. But there is a website, right, Lisa, that you can check the expiration dates of these things. So maybe you can put that link in there, Lisa.
Yeah.
Or you're much better at finding those. But there's a link where you can actually say, I have an iHealth test, or I have this thing, and then I'll tell you like how much longer. But generally, it's been about 6 months. And some people actually say up to a year, you know, they just had to, I mean, who figures those things out? You know, like somebody like makes it up, and, you know, and so I think they have found that the test is still working well 6 months afterwards, and it hasn't been around that long. So maybe it works like even a year after. So we're not, you know, so that's why it's good to check that site.
Yeah, and I just put the link in the chat to the iHealth website.
Nice.
So you would enter your, it says to enter a lot number, and then it will tell you about the expiration date extension. Another question.
Oh, and sorry, can I just say a little advertisement for that? So like, let's say you got sick with COVID, or you think you have symptoms of COVID, right? So you're like, oh, I'm feeling sick. Like, first most important thing is like, don't go to work, don't go to class, like don't spread. It could be flu, it could be COVID, but we also have RSV right now. And RSV is just a fancy name for kind of the common, you know, one of the common cold things is RSV. And we are seeing huge upticks in that. So it's probably like you could get sick, and it could be COVID, like I said, but it could be RSV. So it's really still good to stay at home when you're sick, and also wear a mask around other people when you're sick, because you still don't want to get RSV. And RSV is really bad for little kids, right? Little kids sometimes can get super sick and hospitalized for a long time. So if you do have little kids around the house, you don't want them to get sick with that either. So just some important tips of like, you know, yeah, just like if you get sick, you have symptoms, stay at home, and then go ahead and test with the kit. And then you might want to, do you guys have the COVID quarantine and isolation calculator? If you do take the rapid test and you turn out positive, you should definitely use the COVID quarantine and isolation calculator, because you don't even have to think, you don't have to add, it just tells you what to do. Yeah, so great.
Okay, we still have more questions for you.
Oh, wow, more questions.
Next question is, I recently learned about wastewater being monitored to track COVID spikes and activity. Was wondering if NMDOH is using this practice as well.
Yes, we are. So let's see, we actually have a ton of wastewater sites, the NMDOH wastewater. Let me see. So we have been using it since, gosh, I would say since June or July. We've been getting more and more sites, wastewater sites signed on for the testing. And, you know, this is really interesting because wastewater is one of those things that is relatively new. But the idea is like, it's like, it takes your poop, you know, like, so if someone has COVID and they poop, it goes into the wastewater, and the wastewater can detect COVID. So what they're saying is that it can help us kind of as a sign to say, is COVID increasing in the community? Because a lot of people may not go get a test, or once again, with all the rapid tests going on, you know, you don't know how many people actually have COVID. So it's really a way that we can really track track COVID and get an early alarm system to be like, oh my gosh, there's COVID, a lot more COVID in the community, we can potentially predict a surge. However, it's just one of many data points that we have to take into account. And if, like I said, if you go to the covid.gov website, that one takes into account COVID cases in the community, as well as hospitalizations. So that's another point where we can look and say, hey, what's it going to look like in the next 2 weeks? But yes, we do have that, and I will share with you our latest COVID data, wastewater data report here. I'm going to put it in the chat box, and then I'll just share it with you here too on the screen because it's kind of cool. Let me just share that with you. Like it's okay, so here is our little wastewater information here. This is just an example. Can you see it? And so
Yeah.
on the link, you can go to it, and then you can see all the sites where we're getting wastewater from. And so we're encouraging wastewater, like counties, to get wastewater signed up, right? Like signed up for wastewater because it's all voluntary. And you can see here's some sites where we're getting the water. And then here we have little charts that show here here the blue here. Here's cases like COVID. The blue one is the COVID like water. And then the gray are the cases. So do you see how it like doesn't necessarily super match up? It's just because we need more data. So over time we can start saying, oh yeah, it's a new technology. So over time we're hoping that we can look at it and understand that data well enough to say water, COVID in the water is increasing. We're gonna see cases in the future increase. I don't think it's there yet, quite perfectly yet. Like I said, it's still in its infancy for a new kind of testing, but it's very cool for the future. And also we're hoping to get ability to test things like polio, you know. That's how they discovered that there were polio cases in New York, was that they found it in the wastewater. So pretty cool stuff.
Thank you. And I see in the chat that Ife has a question. Do you want to ask?
Yes, hi, Dr. Pajan. Hi, everybody.
Oh,
How are you?
hi. Good. How are you?
I'm good. I am having a lot of participants that I work with in older community of the waiver that are coming down with COVID. And nobody's talking about it. Everybody's saying, oh, we're through the pandemic. And it's very frustrating, very frustrating. We ran into a couple of issues. Where do you get the tests, the home tests now? That's one question. And after that, I'll tell you the next problem we ran into. And I really have to give a shout out to Ben and to Anshal, because I was lost on one of the participants that was hospitalized, and Ben really helped me, and Anshel put me in touch with him. So thank you for that. But where can you get these tests?
You know, that is a very good question. We still have that, the covid.gov site. I think that has, you know, you can potentially get free sites. What they're doing, what the federal government is doing, is they're trying to move things towards like insurance companies. So insurance companies, I think, give you something like 8 tests a month per person. I'm not actually sure the exact number. And then also on our website, you can still get the tests from our Project Act. That gives you, is it 5 tests per month, Liesl, still? I mean, we still have some funding in that where people can, you know, request a test. And then, but it's not like it was before where they're just giving tons and tons of tests out. I think maybe if you reach out to Liesel, we can see if we have more tests on our team, if people are interested in getting tests. I do think we still have rapid tests for people who want, like if community orgs are interested, you can still request them on our doc form. It's the DOC form.
Okay.
Yeah, so I think that's, but it isn't like before where, you know, people were just like giving out tons of tests. Yeah. Also,
Oh.
yeah, go ahead.
No, go
Yeah.
ahead.
Oh, no. Also, I noticed that if you apply for a vaccine at Albertsons, they give you like 8 free tests or something. So.
Oh, that's good to know. That was another question because in trying to get people signed up for tests, I mean, for shots, the bivalent, the new one,
The Omicron?
we're being directed back to the call center, which is a lot of confusion because people are already registered there, and being given numbers, and especially Albertson Savon is doing this.
They're directing people back to our DOH call center?
Yes, and they're telling them for the vaccine event, they're giving them a number that they can give the center. Because of course, most people already have a number because they've had vaccination.
Yeah.
So can you clear that up? Is that supposed to be happening like that?
I don't think so, but like if you write out your email really specifically what happened and everything like that, you can send it to Liesel right now,
Okay.
and she can forward it to the correct team to try to figure that out. Because I think we can always send it to our mobile team or, you know, the vaccine team to just figure out what's happening. But yeah, if you have a specific concern or something like that, yeah, send it in and they'll be sure to follow up.
All right, my last question, and I'll leave you alone. It's not really a question, it's a comment. In having this participant that was hospitalized, trying to get, when they were being released, an antiviral that they could take, because the hospital said they could not administer Paxlovid or any other antiviral. And the only way that they could get monoclonal antibodies, and they did have other complex medical issues, was if they were going to have a procedure at the hospital and had contracted, this is UNM now, okay, I'm talking about, had contracted some kind of an illness or COVID, then they would give them the monoclonal antibodies, the only one that can work for the variant. And that's the policy of the hospital. There was a lot of frustration around this board that once the person is hospitalized, they have to look into their history and everything and then decide if they can be treated. It was just, to me, it was a hot mess. I mean, I don't know what else to say.
It sounds really complicated. Yeah, I would also reach out, you know, to Lisa, and we can also discuss that with our medical team that you know, that works with UNM, just to say, hey, this is what we're hearing from the field, you know, and that's what's really important about what you guys are doing, because, you know, we can get some of that back to you know, to the hospital system, just as a general. So, yeah.
Okay, so I'll just write an email to Liesel and
Yes.
and tell her all of this stuff. And some of it Ben knows because we spoke about it. But
Okay.
it was very frustrating for the doctor as well.
I imagine. Yeah.
Yeah, his hands were tied.
Yeah,
So
no, that sounds really frustrating, but yeah,
thank
thanks
you.
for sharing with us. Yeah.
Thank you.
Thank you for sharing that. And yeah, please reach out to us so we can troubleshoot. Another question is, can the mobile vaccine team administer the flu shot?
You know, I have been trying and others have been trying to see if we can do this. I think part of it was just the logistics of it, but that's another question we'll ask them. Currently, I know most of our mobile teams are just administering COVID. It's just that the flu vaccine requirements are slightly different than our COVID vaccine requirements, which has been the part that they've been running into problems with. but we will definitely, yeah, once again, Liesl, thank you, Liesl, for collecting all this information and sending it back, especially the vaccine logistics back to our team. So, but it would be great to get both, and we'll work on that.
Yeah, I agree. Rosalba, do you have something to add?
No, this is something that I want to share.
Mhm.
That you know how we're always listening that hearing that, oh, somebody got they put the shot and they got the vaccine and they can move their arm, or they were really sick and all this stuff. So one of our promotoras last week was in a house, and the man was very, she said that we're having COVID clinics, no? So the man, what he shared was that because of his job, he had to get the vaccine, and he only had the first one, no? And then his wife and daughter and son did not believe in it, so they didn't get the vaccine. So eventually they all got sick, and he survived, and the wife and the son died. So I
Oh my
think that,
gosh,
I
that's
know that,
so
I mean, it's a shame, but the thing is that for what we're, you know, how we, I mean, and that he wanted the vaccine and that he was gonna go to our COVID clinic. So I think, and this was like the wife and the son died 2 weeks ago. So
oh my
when they say,
gosh.
people say that, and this is so unnecessary, no, but I think that we have to, I know that we have like COVID fatigue and que no sé qué and stuff like this, but we really, really have to keep on doing it because people are still dying.
Thank you so much, Rosalba, for sharing that. And also, that's such a sad story, but yeah, I think the stories are so important to share because you're right, people are still dying every day. If you look at our website on the DOH website, there's still people dying every day of COVID. And yeah, so thank you for bringing that up. And I think that's an important story to like, you know, share in terms of sharing that, yeah, especially people, and you know, the people who are dying are people of color more than anyone else, but that's also our group that's not getting vaccinated. So I think you guys are a really important part of that, the trust that people have in you, to be able to like really help prevent these really unnecessary deaths. So thank you.
Along with that, a question is asking about if the new 988 number mental health hotline is launched and operational at the moment.
It is indeed, and we'll have our 988 team share, but yes, it is functional.
Yeah, it is a simple question with a complicated answer. There's still certain parts that are being built and developed and piloted right now. But what I can share is that the line itself, if you dial 988, it will connect you to a crisis line and you can receive support over the telephone. And aside from that, that's all I'm really super comfortable sharing at this time, very similar to what Dr. Parajon shared earlier in this meeting, that the number you can call, but not all of the support services are currently available. And so some of the locations, like depending on where you call from, might route you to a different place. Like if your cell phone area code is a certain area code, it might route you to a different center, and then you might have to get rerouted to a more local call center. But that's the info I have that I can share about that. And I do know that the 988 folks do offer open updates and stakeholder meetings that folks can join if they're more interested in the development process. So I'm not quite sure off the top of my head who to reach out to about that, but I think if you go on the 988 website, you should be able to find some folks who you can get in touch with to join some of those calls.
Thanks, Sean. I just want to read this comment that was just put in the chat that says, I'm curious what the educational outreach to medical professionals, because they tell me they ask their doctors about the new COVID vaccine and have been told, no, stick with what you got before, as if they haven't even heard of the Omicron bivalent vaccine. Frustrating. Plus, it seems like so many people don't understand that they need this new booster.
Yeah, that's so frustrating. I mean, but let me tell you, like, you know, when you're a primary care doc out there right now, it is rough. You know, you're like hit and bombarded with so many things. So I can imagine that some of this messaging falls through the cracks as well. Doctors and providers are just like other people who have like too much to do in their lives. But I do think that it's really important for us to keep on sharing this message with our providers. Dr. Miranda shares every other Tuesday with a provider group. And then we also go to the Hospital Association and the Primary Care Association to share. But there needs to be a better way to message out our physicians as well and other providers, healthcare providers, to get this word out. And I think that's something we really are trying to work on. And I don't know, I saw Dr. Anjali Taneja on this call too, that she had like a really good idea of having like a kind of a network for all providers to hop onto where they can get easy information. So I think we are trying to work on that project as well, hopefully. So hopefully we'll have that in the future. But you're right, it is so frustrating. Yeah. It's so frustrating. So I think we do have to keep on our messaging. I do know that they're doing a lot of advertising, but you know, thank you for continuing to say that. We've heard some of the same things as well from providers. So yeah, it'll just take time for the message to fully get out.
Yeah.